In this video, we'll discuss about pancreatic function test. Now look at the anatomy of pancreas outline. Pancreatic parenchyma or soft tissue of pancreas is mainly made up of two types of cells. Pancreatic parenchyma is made up of two types of cells. First one is pancreatic cells of islet or islet of Langerhans. First one is pancreatic cell of islet or islet of Langerhans. Second one is acinar cells. These acinar cell secrete digestive enzyme. Pancreatic cell of islet, it have various types. It have alpha cell, beta cell, delta cell and F cell. It secrete various type of hormones. So this one pancreatic cell of islet, it will secrete various type of hormones. This one will acinar cell will secrete digestive enzyme. Now look at functions of pancreas. Pancreas have two important functions, endocrine function and exocrine function. What is endocrine function? That is hormone secretion. Function of islet cells. It have beta cell secrete insulin, alpha cell secrete glucagon, delta cell secrete somatostatin, then F cell secrete pancreatic polypeptide. So endocrine function, they secrete some hormones. Example, alpha cell secrete glucagon, beta cell secrete insulin, delta cell somatostatin and F cell secreted pancreatic polypeptide. Second one is exocrine function. Main function digestion. There are functions of acinar cells. Here main function because of this acinar cell. Acinar cells secrete enzyme for digestive purpose. Proteins digestive enzyme like trypsin, chymotrypsin, carboxypolypeptase A and elastase. Protein digested by enzyme trypsin, chymotrypsin, carboxypolypeptide A and B. Peptase, carboxypolypeptase A and B. Then elastase. For the digestion of carbohydrate, acinar cells secrete pancreatic amylase. So for carbohydrate digestive purpose, this acinar cells secrete pancreatic amylase. For fat digestion or pancreatic lipase, cholesterol, esterase and phospholipase are secreted by acinar cells of pancreas. So the secretion of digestive enzyme are the exocrine functions of pancreas. Another property, it also secrete large quantities of bicarbonate ions. So it also secrete large quantities of bicarbonate ions that used for food digestive purpose. Next, outline of pancreatic function test. As pancreas have two types of function, exocrine and endocrine function. So the functions of pancreas is again two types, endocrine function, exocrine function. Now the test for endocrine pancreas function. This one used for assessment of individual hormones. That is insulin, glucagon level, assessment of stomatostatin, etc. Another test are plasma glucose level estimation. We already discussed that things. That insulin, glucagon, stomatostatin. Another test are assessment of this one plasma glucose level estimation, oral glucose tolerance test depended on the insulin secretion and action. So endocrine secreted hormones, this one used for assessment of hormones, plasma glucose level estimation and oral glucose tolerance test. Second type of test for exocrine pancreas. This is again of three types. Invasive test for exocrine pancreas, non-invasive test for exocrine pancreas, and blood test. Largely that radiological evaluation studies or imaging studies like USG, MRI scan, CT scan are also needed for the assessment of pancreatic function. Then imaging studies like USG, MRI and CT scan also needed for the assessment of pancreatic functions. So these are the tests for pancreas: invasive test, non-invasive test, blood test and radiological test. The clinical sign and symptoms of pancreatic exocrine deficiency occur when at least more than 50% of acinar tissue are damaged. So the sign and symptoms of pancreatic exocrine deficiency occur when at least more than 50% of acinar tissue are damaged. So more than 50% of acinar tissue damaged, then only sign and symptoms will occur. Now, utility of the assessment of functions of pancreas. Utility of assessment of functions of pancreas. First utility functions of pancreas: pancreatitis, that is inflammation of pancreas. The second one is chronic diarrhea. Third one is malabsorption and maldigestion. Then cystic fibrosis. This one is a genetic disease affected pancreas. Then primary and secondary pancreatic insufficient syndrome. Then anatomical or morphological disorder of pancreas. There is the inborn error metabolism. Then pancreatic carcinoma. These are the case or condition where need to assess the pancreatic function. What are the condition? Pancreatitis, chronic diarrhea, malabsorption and digestion, then cystic fibrosis, primary secondary pancreatic insufficiency syndrome, anatomical or morphological disorder, and pancreatic carcinoma. Next, how to collect pancreatic juice. You have to insert double human catheter which is having radio opaque tube. We can trace it with the help of X-ray. So radio opaque tube passed through either nose or mouth till the tip of tube reaches to the duodenum near the ampulla of water. It has two set of hole. First one to collect pancreatic juice, that is duodenal aspiration. Second to collect gastric juice for gastric aspiration. Other method we can also use fiber optic catheter that is also introduced under direct vision into the pancreatic duct. We can collect the pancreatic juice after fasting, collecting deodorant and gastric sample. So here we will insert double human catheter having radioactive. With the help of X-ray we can trace it. We can insert through either nose or mouth until the tip reach to duodenum near the ampoule of water. It is said two holes is there. First one collect pancreatic juice, second one we collect gastric juice. Another method we can use fiber optic catheter. Sample fasting sample by using that one duodenal and gastric sample we can collect. Test for exocrine functions of pancreas. First test name is called as invasive test. Invasive test is required GI fluid aspiration by intubation. What is done by this test after an overnight fasting? Stimulus for secretion of to pancreas is given. So here stimulus will given for pancreas secretion. After that opaque tube inserted into the duodenum. So it will inserted into duodenum of that patient and the secretion that is secreted by pancreas is collected and this GI fluid aspirate can be measured. And what are the parameters to be measured? First one is total volume of pancreatic juice. Second, amount or concentration secreted by carbonate. Third one is activities of pancreatic enzyme. These are the assess from the GI fluid aspirate in the invasive test. Now, this is the principle of invasive test. Based on this principle, following tests were designed. First one is length test. Second one is secretin stimulation test. Secretin and cholecystokinin are the stimulus for pancreas for secretion of digestive enzyme. Secretin and cholecystokinin are the stimulus for pancreas for secretion of digestive enzyme. What is done here? Secretin are injected intravenously and now the GI fluid is collected and this GI fluid aspirate is assessed for the above parameters. And second type of test is secretin cholecystokinin stimulation test. Here the patient intravenous injection of secretin cholecystokinin are given and thereafter GI aspirate is collected and assess above parameter. This is all about that invasive test. Now coming to non-invasive test for exocrine pancreas. Here no opaque tube insertion is needed. No GI intubation is needed. No GI intubation is needed. Here what are the tests? We can estimate. First one is fecal chymotrypsin level. Second one is fecal elastase 1 estimation. This is done by monoclonal antibody method. And it is the non-invasive test of choice, that is the fecal elastase 1 estimation. Other tests like N-benzoyl, L-tyrosyl, P-aminobenzoic acid, NPT power test. Then pancreatic test. Pancreatic test. Amylase has mainly three types of isoenzyme: P type, S type, M type. P means pancreas type of amylase. S, this is secreted by salivary gland, so S type. Then macroamylase, amylase moiety found with immunoglobulin IgG or IgM. IgG and IgM bigger molecules, so amylase bind with IgG and IgM molecules, so this is again form a big amylase protein which is called macroamylase. This macroamylase not excreted through our kidney. Post-translational modification gives rise to many other isoforms. Then distribution in body, where from the amylase secreted, where from this amylase secreted, first pancreas, next salivary gland, ovary, fallopian tubes, lungs and adipose tissue. These are the sites where amylase is secreted. Now this reference interval of amylase is serum or plasma less than 90 unit per liter. It is depending upon the kit. Next method of estimation of amylase, IFCC method at 37 degrees Celsius. IFCC, International Federation of Clinical Chemistry method at 37 degrees Celsius. Next, sample collection. Blood is collected in clotting or heparinecide. The tube are EDTA vials. So samples are collected by using clotting tube or heparinized tube or EDTA vials. Fasting sample is preferred. Sample stable at room temperature for 5 days. If we kept in 2 to 8 degree for 1 week. Room temperature means 5 days. 2 to 8 degree means 1 week. Serum or plasma, both can be used for this test. Sample should be free from hemolysis, high bilirubin and triglyceride level. Urine can be assayed also. Urine can also used. What is the principle? Direct substrate method used here. 2-chloro-4-nitrophenol salt is hydrolyzed in the presence of amylase enzyme which give chloronitrophenol. Patient sample mixed with the reagent which containing 2-chloro-4-nitrophenol salt. This one hydrolyze presence of enzyme amylase to form chloronitrophenol. Amylase hydrolyze the salt into chloronitrophenol. So amylase hydrolyze this salt into chloronitrophenol. The rate of hydrolysis of the reaction is measured at 405 nm wavelength. So that hydrolysis is measured at 405 nm wavelength. This is the principle. Then now causes of increased volume in blood or plasma. What are the causes increased in this volume? First causes pancreatic causes. pancreatitis or trauma. Second cause, intra abdominal cause, that is intestinal obstruction, then perforation in GI tract, appendicitis, then stomach ulcer, gastritis, duodenitis, and peritonitis. All these conditions, amylase level will increase. Then genitourinary case, ruptured tubal ectopic, ruptured tubal ectopic, then ovarian carcinoma. Other causes, salivary gland diseases, septic shock, macroamylasemia, then diabetic ketoacidosis. Macroamylasemia condition, immunoglobulin bind with this amylase, bind with IgG and IgM. Second one is lipase. What is the chemistry form of lipase? It is triacyl glycerol hydrolase. It is hydrolase TAG, triacyl glycerol. It attack 1,3 alpha position, 1,3 alpha position of triacyl glycerol. Lipase is small molecule and it can be excreted by the kidney and urine containing lipase. It is a glycoprotein in nature and small molecules. From where it is secreted? It is secreted from pancreas mainly, then gastric mucosa, pulmonary and intestinal mucosa also. Now full remember, catalytic activity is present in the presence of bile salt and a cofactor is called cholipase. Reference range within 60 unit per liter. Method of estimation of lipase, you can measure lipase by using various method: trimetric method, spectrophotometric method, fluorometric method, immunometric method, turbidometric method, enzymatic color test. So these are the method used for estimation of lipase. Trimetric method, increased value of lipase observed in mainly acute pancreatitis. It also increased in chronic pancreatitis and obstruction of pancreatic duct. Next, sample collection. Sample is collected by using clotted or heparinized vials used, mainly empty stomach. Then samples can be stored for 7 days at 4 to 8 degree Celsius. Urine sample also used. Next, what is the principle? 6-methyl resorubin ester hydrolyzed by lipase to give dicarboxylic acid ester. Then this one is acted upon alkaline test condition. It will give chromophore methyl resorubin. The rate of color formation is measured at 580. Increased value of lipase observed in acute pancreatitis, mainly acute pancreatitis. It also occur in chronic pancreatitis and obstruction of pancreatic ducts. The sample collection, blood sample is collected by using clotted or heparinized vial. Mainly collected sample in empty stomach. Sample can be stored for 7 days at 4 to 8 degrees Celsius. Urine sample also used. Then what is the principle? 6-methyl resorubin ester hydrolyzed by lipase gives dicarboxylic acid ester. This dicarboxylic acid ester alkaline test condition will form chromophore methyl resorubin. Chromophore methyl resorubin. The rate of color formation is measured at 580 nanometer wavelength. Caution in test interpretation. Renal failure causes increased value of lipase and amylase in blood. Thanks for watching.